Okay, well, Carrie, we're here in one of our community rooms, and this is a perfect example, I think, of some, a typical room that we have, and maybe cats that have been here a long time that might need a foster home break. So let's talk about that.
Absolutely. Every once in a while we'll find a kitty that's not eating, perhaps they're not coming out from their hiding spot very often, not integrating into the room, not interacting with the public. They seem to be depressed, showing signs of depression. So what we'll do is we'll try to change up their environment, and we'll put them in a foster home, usually in a room by themselves, away from the other pets in the foster home, where they can kind of relax and start to blossom on their own time.
Sure. Now, why is that? I mean, obviously, I mean, people tell us all the time, oh, you got a beautiful facility and this is really great. But, the bottom line is that nothing beats a home.
Absolutely.
Nothing beats a home.
In this room we're standing in, there are probably 8 to 10 cats, and this is a small room. So these cats have carved out this room into tiny territories. And that can be really, really stressful on the cats, especially since the territory lines are constantly changing as cats move out and come in.
Sure. And I think it's important to note, too, that this particular room has older cats in it. We are seeing a significant number of cats being surrendered now that are older. Because people financially, because you said it before, the economy just really isn't supporting sometimes people keeping their pets, and so we're seeing older pets come in, and that's along with keeping with our life-saving mission. That doesn't mean we would euthanize simply because they're older. If they're in good health and they have quality of life, we certainly would keep those guys and find them a home. But in the meantime, obviously there could be some long-term community animals in community rooms, and that can have an effect on them, and that's what you're talking about.
Yep, they do burn out.
Right. The stress level can get quite high, I think. They can become depressed. And you said it yourself, we need to change up that environment. Now, maybe while we're talking about that, we could discuss the fact that what's the benefit of maybe adopting an older pet?
Oh gosh, well, a lot of people will come in and they'll say, I've got a busy schedule, I'm looking for a cat that can be independent. But sometimes they're gravitating towards the kittens. An older cat is going to be able to be alone a little bit longer during the day than a younger, more active cat is.
And obviously, they like to sleep a lot.
They do.
Yes, they do. But I mean, obviously if you're looking for a lap sitter or you're looking for just a companion and maybe somebody, not a Zoom kitty, obviously.
Absolutely.
And I think it's important to note, too, that we just recently received a very generous grant where we can do blood work now on older cats. And so we're going to be doing geriatric panels. So that will give some assurance to people that, not that, we're 100% guaranteed, but that obviously the animals are healthy at that point. Good. All right, fantastic. Well, Carrie, why don't we move on to a couple other candidates that would be good for foster care?
Sounds good.
Okay. Well, Carrie, we're here at our extended care, which is a very specific area for what we call our sick kitties. Usually our kitties have upper respiratory virus and they have to be totally isolated from the rest of the population. For me, this room is always kind of sad. And the reason it is because of the isolation. As you can see, we've got stainless steel cages behind us here, and this is how we keep our kitties isolated from other kitties. But it really, it's really kind of hard for these cats because they're only handled for, medication, for feeding, cleaning, and those kinds of things. And it's not really that they're handled or socialized like some of our other kitties that are available for adoption. So why don't we talk about the benefits for these cats, obviously, to get into a foster care. And then maybe specifically some of the cats here that we're looking for.
Well, like you said, these kitties are not handled very often. The reason for that is we don't want to spread infection throughout the building. So unfortunately, the staff here are constrained. We have about 270 cats right now in the shelter's care. We can't touch sick kitties and touch healthy kitties afterwards. So if these cats from this extended care ward can get into a home, not only do they get touched, loved on, handled more, their stress level goes way down outside of the shelter environment, and they heal much more quickly.
Yeah, and I think that's, you know, I talked earlier about the fact that it would be great if we had some people that were comfortable sometimes with some of these medical issues. And this isn't anything real extensive. You know, it may be giving a pill, or it might be giving eye meds or something. Not to say that a person couldn't be taught how to do this.
Right.
So I think that's important for people who might want to help our special kitties that are just kind of getting over a upper respiratory virus. That would be really wonderful thing
Absolutely.
to do. We also have another kitty, I think, that is somewhat of an unusual case, but I thought it was important to talk about that. So why don't we do that?
Sure. This is Butters. Butters has been exposed to feline leukemia. We've tested Butters twice, and the results have been negative.
Right.
But to be 100% sure, or as close to 100% as we can get, we like to wait a month after intake and retest them, because there is a small chance that they could still be positive if they were exposed right before they came to the building.
Now, what would be the danger to a person if they were to take Butters home for a month and put them in a separate isolated room?
Well, obviously if they have the other cats, since there is the potential that this kitty could have feline leukemia, we want to make absolutely sure that this cat is not going to come in contact with anybody's pets at home. Right. Ideally, someone that doesn't have any pets at home, this would be very, very easy to manage at home. Otherwise, you just have to be in a secure, safe room. Another danger, this might be a little bit more emotional, because if she is positive, if she ends up being positive for feline leukemia, we'll try our best to get her into a rescue or find a home for her, but she could potentially not be adoptable.
Right. Obviously, because feline leukemia is not anything that can be cured, so to speak. But cats can live a long life with it.
They can.
But unfortunately, they can also pass it along to other animals.
Yes.
So, you know, it's something for people to think about. We have adopted out feline leukemia positive kitties, but those homes are somewhat few and far between, and so it's difficult sometimes.
Yes, it is.
So let's talk about some of the other ones maybe that we also have here that, you know, and I don't know if the viewers can see, but some of these cats are like just dying for attention. They're just, you know, they're reaching through the cages, they're trying, you know, pay attention, pet me, you know. And, you know, it is heartbreaking. You know, it's heartbreaking to not be able to pick them up and hold them and cuddle them. And, you know, in a home environment, obviously, all those things can happen. So this is a good example of somebody that I want to talk about here. This is little Winks. Okay. And maybe a little bit hard to see because it's a black kitty, but why don't you tell us a little bit about Winks?
Winks is only 2 months old. Winks, you'll notice, has a little bit of a sore above his right eye. That's from a botfly. For our viewers that don't know what botflies are, botflies will actually lay their eggs, so a larva can grow in the skin of an animal. Right. So dogs, cats, a lot of outdoor animals can get botfly larvae. His larva that was growing in his head was removed, and that sore is healing up. Right. He also has an upper respiratory infection, so he's getting a liquid antibiotic to help make sure that botfly bite doesn't become infected, and to also treat his upper respiratory.
Right. And I know when he came in, I was here that particular morning that he came in, and he was a little outside kitty, and he was dehydrated, so he had to be rehydrated, and he was extremely hungry. And, you know, life outside is sometimes very, very tough. Yeah. And I'm going to guess this little guy had no support like a mom. Right. And it's an unfortunate thing, but he's also social. But he'll become more social, correct?
Absolutely.
If he gets handled, if he gets petted and stroked, and you know, and he gets accustomed to people more so than, you know, what he's going to get here in this environment.
At his age, it's a real tragedy for him to sit in a cage like this without companionship.
I mean, it's just, you know, it really is. It truly, truly is. I mean, it kind of breaks your heart for some of these guys. And, you know, I'm just going to step back here so maybe you can see some of the other kitties that we have here. And like I said, they're all looking for some attention. You can tell just by his cage is really messed up. And part of it is because we've got a very active young kitty here that just really is having trouble being restrained in this smaller cage, you know. So I think if we could, again, find them, you know, a foster home where they could be treated and And as you said, they would recover much quicker.
Absolutely.
And we'd be able to put them immediately up for adoption. So
we have some foster homes that prefer to actually take kitties with upper respiratory infection because that transformation and healing process is so rewarding for them to watch.
Sure. Now, Carrie, obviously this show is primarily about foster care. And we are really kind of desperate for foster homes right now. So how, you know, this show is about recruitment. It's about getting people interested and so on and so forth. So, you know, we obviously want to market the advantages to doing this, but maybe you could tell people a little bit about, you know, your personal experience, but you know, what your expectations would be for folks and maybe what they can expect to get from it as well.
Oh, sure. Well, you know, we're just desperate to get these foster homes. We try to make it easy for you to become a foster home and give you all the support that you need. We just expect that you'll give basic care to the animals, you'll give them their medication, and you'll just give them love. That's really what we're asking. There's a minimal time commitment as far as driving. You would need to be able to transport them back to the shelter for vaccines or any kind of medical treatment. If foster home cannot take the animal to a vet, if they need veterinary care, they can drop off at the shelter and we'll handle that kind of transportation.
Is there any training?
There is training. I set up training courses by appointment. We do a monthly foster care class, but I really want to emphasize on this show that I'm open to doing training now. Anytime that a foster home has time or a potential foster home can come in. My schedule's very flexible. I work around anybody's availability to get them the training they need.
So if ideally, how many foster homes do you have now?
Ooh, that's a good question. I think we have over 40 homes, but they're not all active right now. We have some seasonal homes.
How many would you like to see to make this a comfortable level?
Oh man, it would be wonderful to have at least 20 more homes. It would really make a huge difference.
So hopefully people that are seeing this show and maybe listening to it would consider obviously becoming a foster parent and helping these animals out, because you said it yourself in the beginning of the show, they're saving lives. They're helping to expand the walls of the shelter, and because of their generosity, they're able to give animals a second chance. So we appreciate that. So with that, Carrie, I think we're probably going to wrap up the show and we're going to say happy tales to you.